maintenant, c'est l'occasion de faire encore un voyage dans un pays en guerre et de donner la parole à notre ami le professeur Shlomo Schnenbaum, qui va être présenté par Carole Matelin, puisque c'est un collègue qui a été président de la Société internationale de scénologie, société à laquelle Carole participe. Et c'est un plaisir et un honneur d'avoir un Israélien qui vit en Israël, dans un pays en guerre, qui vienne prendre la parole au ministère de l'Enseignement supérieur et de la Recherche en France. Merci. Merci beaucoup.
Donc, quelques mots sur Shlomo. C'est quelqu'un de remarquable dans la Société internationale de scénologie, qui est une société qui est née en 1974, donc très ancienne. Shlomo fait vivre cette société. En particulier, il accueille beaucoup d'étudiants qui viennent se former à la scénologie. Ce sont des cursus de 2 ans. Et il a été aussi patron de la Société israélienne de scénologie. It's a great honor, Shlomo, to welcome you here in our National Academy of Surgery. Thank you very much.
Thank you. I hope that you hear me, yes?
Perfect. Perfect.
Okay.
Very good connection.
Okay, the slides, you see the slides or you don't see the slides? I don't know.
Not yet.
Or I have to
Can you share your slides, please?
I should share my slides? Okay.
Yes.
Okay.
It's coming.
It's coming. Okay. First of all, I would like to thank you for the honor and the privilege to present this data. And I'm really honored by this. We had a challenge in Israel in the recent years. Finding fellowship position abroad has become more challenging. At the same time, there has been a growing interest in breast surgery in Israel. The training aimed to develop expertise in breast surgery in a comprehensive way, that oncological treatment of breast cancer, in which such aspects of the overall treatment. 4 years ago, after a long trial, with the help of the Council of Israel Medical Association and the Israel Surgical Association. The Israel Medical Association is the one who gives the accreditation for being a specialist. In cooperation with the Society of Breast Surgery, the Israel Sonologic Society, we were able to establish the training of fellows in the subject of oncological surgery of the breast. To this end, a multidisciplinary training program was put together, including 2 months in oncology, 1 in breast imaging, 1 month in pathology, and 2 months in plastic surgery. A program that differs from any other surgical specialty. In addition, there is a requirement to write a clinical research paper, an interview with the committee member at the end of the term. It is necessary to submit a list of surgery. We should include a predetermined minimum number. In order to do this fellowship, there are 2 components. One component is the site. Which site can give a fellowship? The site requirement was a unit that is administratively approved by the body, authorized for this by the Ministry of Health. At least 2 doctors specializing in surgery were employed full-time. Most of the occupation is in the field of breast surgery, and one of them is the head of the unit who had undergone recognized training in Israel or abroad of breast surgery as part of training in oncological surgery, like myself. This unit have the capability of consulting, diagnosis, and treatment of women with risk factors for breast cancer, consulting and screening tests for early detection of breast cancer for women aged of 40 and women in general, orientation and customization for early detection of breast cancer, and to form all breast examination, ultrasound, mammography, MRI, and nuclear medicine. Surgery is specified with marking, with needle staples, radio-guided ultrasound, biopsies, and mammography and imaging session with experts in radiology. RICF also to do sample of lymph node in the axilla, lumpectomy, and the institute of the clinic, there is orientation and personal adjustment for patients undergoing mastectomy with reconstruction in collaboration with plastic surgeon. Every site have at least 150 surgery per year, excision of lumpectomy in at least another 100, mastectomy of all time at least 30, detection of lymph node in the axilla, level 1, 2, and 3, sentinel lymph node dissection at least 50, cooperation with plastic surgeon, breast reconstruction, oncoplastic surgery, and the doctors of the unit have to show participation in national meeting, seminar in the field of breast surgery and oncology. And the second component is the target population. Target population are specialists in general surgery who wish to expand their knowledge as specialists in breast medicine in multidisciplinary aspects. The criteria to be a candidate for such a fellowship is expert certificate in general surgery and license to practice medicine in the state of Israel, department manager recommendation, hospital director recommendation, recommendation of a member of the Society of Breast Disease, and the age of the candidate should not exceed 45 years. And the goal is to acquire of this candidate is to acquire knowledge and expertise in all aspects of breast oncological surgery with deep understanding of benign and malignant breast disease for clinical and research application, knowledge of the anatomy, physiology, and pathology of breast and axilla, acquiring skill and understanding in percutaneous biopsies under imaging guidance, the understanding of genetics of breast tumor and test, both pathological and genetics, based on all the above to tailor the appropriate personal treatment for each patient. This candidate have to acquire knowledge of and being skilled in surgical technique, including breast conserving procedure and resection, comprehending and using orthoplastic technique and reconstruction as needed in collaboration with plastic surgery. Knowledge of complementary and pre-surgical oncological treatment, including complementary and intraoperative radiation. Engaging in clinical research, presenting work at conference and publication. The requirement of the fellow is to treat patients with breast disease in the world, preparing patient to surgery, participation in surgery, post-operative follow-up, participation in morning and evening rounds, ordering tests and deciding on treatment of patient, treatment and follow-up patient in outpatient clinics, active participation in oncology clinic, participation in X-ray and pathology meeting, an integral part of fellowship training is breast diseases in clinical research. Clinical research can be retrospective review and prospective studies are all options. Combining different departments to the country as a part of the research will lead to mutual fertilization and more significant results. The recipient will publish at least one article as a first author, a work that will be presented at the national conference and will be submitted as part of the requirement for receiving a full post-fellowship. But also the host department have some commitment. It has to allow the fellow to perform or participate as a second or first in most of the breast surgery during the period of that he is in the department, allow the fellow to actively participate in breast clinic, avoid assigning him into routine department activity that is not related to breast surgery. It must be remembered that the doctor who is an expert and profitable in a specific subject. It is necessary to reveal what is worthwhile for weekly department and multidisciplinary topic of the breast. The fellow should be involved in conversation with the patient and the family members with the help of a psychologist or a social worker. At the end of this fellowship, there will be a documentation and accreditation. This is being done by the Scientific Council of the Israel Medical Association. Criteria for receiving this certificate is a discussion of special cases of breast tumor, case management, presentation of research paper or scientific publication in conference, letter of recommendation from unit manager and or a professional supervisor during the fellowship. There is discussion of the cases. It is the responsibility of the continuing medical committee to appoint prior to the discussion 3 experts from different categories to lead the discussion. If the fellow inability to litigate a case on date A, it allows him a second chance for a new date within a period of 6 months. So what are the results of this trial? In the first year, we had 4 sites, 3 candidates, all finished successfully and presented the work at a national meeting. In the second year, we have 5 sites, 6 candidates, and 5 started their fellowship on June 1, 2024. The sites are Tel Aviv, Soaski Medical Center, Rabin, and Shiva Medical Center, in Jerusalem, Hadassah Jerusalem Medical Center, and in Haifa, Carmel Haifa Medical Center. I would like to thank you for the privilege, and I would be happy to answer any questions.
Bravo. Merci. Le micro, s'il vous plaît. Oh. Merci.
Merci beaucoup au professeur Schönbaum pour son très bel exposé. Je vous rappelle simplement que l'année prochaine, les RICF auront lieu sur le cancer du sein et donc nous souhaiterons que vous puissiez y participer en présentiel et puis à titre personnel, mais comme ancien président du club d'amitié France-Moyen-Orient, bien entendu, tous mes voeux vous accompagnent pour une paix durable avec le respect de tous les participants. Et je sais que vous y participez. Et donc, merci encore de votre présence.
Merci.
Shlomo, you will be invited to France next year, in October.
What did you I'm sorry.
Oui, professeur Schönbaum, je voulais, en tant que président des RICF 2024, vous remercier de votre téléprésence. Et je voudrais vous souhaiter, comme à tous les Israéliens, une paix prochaine en faveur de tous et en particulier, bien sûr, d'Israël, mais également de l'ensemble du Moyen-Orient. Vous êtes, en tous les cas, pour l'université française, vous êtes les bienvenus en France. Et tous les mouvements dont on a pu entendre parler ces derniers mois sur les universités françaises, évidemment, nous ne participons pas à ces mouvements qui n'ont pas de sens et qui ne méritent pas que nous nous y attachions. On vous remercie de votre présence. Merci beaucoup.
Thank you very much. I really appreciate it, and I do wish to be in France after. Thank you.
Merci beaucoup.